because this is cellular angiofibroma. I would like to add of genital, because in soft tissue part, as I know, at least 4 entities. We call it angiofibroma, and then all of them are not related. Anyone can say other angiomyxoma? What is the location of the other? Anyone have any idea? One location is from the face. That is from derm path, aka fibrous papule. That is the angiofibroma. And then we have one from soft tissue. We call this angiofibroma of soft tissue. And then also we have one in the ENT. That's the nasopharyngeal angiofibroma. So all of these entities, I think histology looks different, but they all of them have the name angiofibroma. So for this entity, they have cellular in front of angiofibroma. And then the terminology for this one is a benign, moderately cellular genital stroma neoplasm composed of spindle cells and often contains small to medium-sized vessel with hyalinized wall. So for this entity, we have a lot of cells and then a lot of vessel, and this vessel is not big, small to medium size, and then they also have hyaline thick wall, so just like the deep angiomyxoma. For the clinical picture of this entity, middle age to older adults, and it can occur in both female and male, usually well circumscribed, painless mass. So for the microscopic feature, as I mentioned, they have more cellular hypercellularity of this lesion. They usually forming kind of like lobular or nodular looking, also separates by fibrous septate. And then the vessel is small to medium size, but they have hyalinized vessel wall. They may contain some of the mature fat tissue. So even low power is looked completely different from all the entities we already talked about today. They're forming this nodular, multilodular, and then separated by this fibrous hyalinized septate. And even in low power, we know not a lot of stroma here. Most of this area are cell, so this is hypercellular. Then we have this medial to small size of vessel, but we can see this hyalinized vessel wall. And then the blend, and then the cell, spindle cell also blend. Rarely see mitotic figure. And then for the immunostaining, really characteristic, this is one of the entity we can see CD34 positive and loss of RB1. And then at least we have another 3 entity with the characteristic CD34 positive and loss of RB1. Anyone have any idea? What do you think about other 3 entities? I can tell you the location. One is from the breast. One is from soft tissue. One is from the acrocyte, that is the finger. Anyone can remember what kind of entity with this immunostaining feature? So from the breast, we have myofibroblastoma. Then from the acrocyte, we have SAF, superficial acrofibromyxoma. And then from soft tissue parts, that is the spindle cell lipoma or polymorphic lipoma. So all of these 4 entities, you will see CD34 positive and loss of RB1. Maybe they have the same pathognomonic So let's see the virtual slide. So in low power, we can see this multi-nodule with really hypercellular looking. And then we zoom in, so tons of cells, these bland looking spindle cells. Then we try to find the vessel. This where, yeah, here we have tons of this hyaline vessel wall vessel here. So, but the cellularity is really high, and then evenly distributed. You won't see just like AMFB. We can see hypocellular and hyper and hypocellular area. All the lesion like here is really hypercellular. Another one, multiple nodule separated by these fibrous septae. And then this one we can see entrap some adipocytes here. And then really hypercellular. Zoom in to see this vessel wall, really hyaline thick wall vessel. And then lots of these bland looking spindle cells, but they all look like the same. And then cellularity is relatively high. Okay, so for this soft tissue part of GIM,